Hi, my name is Chelsea Smith and I'm going to be doing my IV assessment video. So first, I don't know if I need to say all the pre-procedural steps, but I'll go ahead and do it. Before I entered a patient's room, I would check my orders, gather all my supplies. I would wash my hands, introduce myself to the patient, provide them privacy by either closing the door, pulling the curtain if there is one, explaining what I'm here to do, and then raising up the bed to my comfort level. But like I said, today we're just doing the IV. So we've got our primary bag here, which is typically used for hydration. So I'm gonna go ahead and open this. And then my primary tubing as well. So first, right when I open this, I'm going to immediately close my roller clamp here so I don't lose any fluids. I would also be wearing gloves if I were doing this in the patient's room as well. I'm probably not doing it in the bathroom either, but so I'm pulling off my little end cap there. Just using my spike. I'm just gonna stick this in. All right. Technical difficulties. Okay, got it. Hang this here. I'm going to pull my drip chamber, fill this up about halfway, and I'm going to leave that there for now. And then going into my secondary bag. This is typically for medicine, antibiotic, that sort of thing. And then I've got my tubing for this one. I'm going to go ahead and raise this one up here. We want our secondary bag to be higher, so gravity's on our side here. Same thing with this guy. I'm going to pull off the end. These are so hard to get in. Stacy said they wouldn't be this hard in the hospital, so I'm hoping that's the case. Did I get it? Yes. Okay, so same thing. Making sure that's clamped all the way. I do not want to lose any medication, especially out of the secondary bag. So same thing here. I'm gonna fill that drip chamber about halfway, and then I'm going to prime both of these. So don't need this guy. So I'm just gonna slowly let this out. I wanna make sure there's not a lot of air bubbles because I don't want that going into my patient. We're moving nice and slow. This one's acting real funky because it's wide open too. Almost there. Okay, now I'm going to clamp it back up. So that one is completely primed down to the end. We're going to do the same thing with this one, being super careful once again because it's medication and it moves so quickly because this one's so much shorter. Okay, and we've got that one down to the end as well with no air bubbles. So then we're just going to connect these two, and this one is going to go on the port that's closest to the primary bag. So I'm just taking my little end cap off. I would scrub the hub for 15 seconds if I had an alcohol swab. And then I'm just gonna push and twist that on there. And then this part would go into my patient. And I think that's it. I would do my post-procedural steps if I were gonna be doing that. Making sure that I let the patient know when I'll be back, ask if there's any questions. I would, right when I walk in, I would want to assess that IV site, make sure there's no redness, there's no swelling, no tenderness, and make sure that it is clean, dry, and intact as well. So once my patient was good, if he or she didn't have any questions, I would let them know when I would be back. I would wash my hands, clean anything that I used, document everything, and that's it. Thank you.